Let's get more on the implementation of this vaccination programme. I'm joined by Sam Rose, Director of Planning at UNRWA. Thank you for joining us. Sam, can you just tell us, first of all, how polio is spread and how concerned are you about the levels that it could be at?
Absolutely. Thank you. I mean, we're deeply concerned about the levels at which it may be at. There's one confirmed case that your reporter referred to. There may be many more because the health system here has been decimated largely over the past 10 months. The bombardments, the destruction of clinics, the collapse of water and sewage, solid waste management infrastructure, the malnutrition. These are precisely the conditions in which a vaccine like this reemerges, a vaccine which had been eradicated for more than 25 years inside the Gaza Strip has reemerged. So we're deeply concerned. And at the same time, we welcome so much, as everyone here does, the respite for just a small amount of time from the bombings, from the evacuation orders, that we hope will allow us to administer a successful campaign, working closely with the World Health Organization, UNICEF, the Ministry of Health, and other partners. But as you said, this is a massive effort. We just really hope that it will be successful for the children we're vaccinating.
The disease re-emerging, of course, rather than the vaccine re-emerging. But just explain for us how you actually get to all the children and how can you be sure that all the children there will be reached? Is 3 days enough?
3 days perhaps isn't enough, as your previous interviewee said. And this will be 3 days across 3 different areas of the Gaza Strip: the southern governorates, the middle governorates, and the northern governorates. The vaccines, most of them have now arrived in Gaza. The personnel who will administer those vaccines, who will register the children, who are raising awareness amongst the community, have been hired, have been trained, are out there. But doing anything in Gaza right now is incredibly difficult. Surviving the night is very difficult. So we face a number of challenges. The fact that there will be pauses, humanitarian pauses, the fact that there will be no evacuation orders make our lives more easy. It means that we can distribute the vaccines, the fuel, the staff to the areas in which they need to go. And UNRWA, my organization, will be vaccinating up to half of these children. We've taken on about 1,100 of our personnel will be involved, and we'll be vaccinating at our primary health clinics that we have, at health points that we've set up in areas that people have been vaccinated to. We have mobile teams who work in the dozens and dozens of schools where hundreds of thousands of people are sheltering. And we will do what would previously have been house to house, but now is tent to tent, largely, given the realities of the situation in which people live. But reaching that more or less magic number of 90% of children will be very difficult because we don't quite know how many children there are. We don't know how many are still alive. We certainly don't know precisely anyway.
Sam Rose, I'm so sorry to have to cut in. We're out of time on this, but we do really appreciate you giving us that explanation. Director of Planning at UNRWA, thank you very much.